also be explained using fundamental cause theory. Who has a biology minor or double major in biology? So do you know McKenna-Wieniawski?
A little bit. I think we talked about it in a couple of my classes, actually.
Okay. And this is her thesis. I'm her outside member. I don't know if you know. I think biology students, master students, are required to have an outside member for their committee. I am her outside member. I'm the only non-clinical person in here. So this is my limited understanding of her thesis. Correct me if I'm wrong. Since you know her, maybe you know her research. Rob.
Oh. I suppose I'm not familiar with it. I'm not familiar enough with the topic to correct what you have.
Okay. So, this is my limited understanding of peanut allergy. I took a course in pathophysiology a long time ago as my general studies requirement in college 20 years ago. And exposure to peanut can trigger IgE response. And not only this, the antigen in our gut can also give rise to Th2. We can Google Th2 later. And Th2 is going to activate B cells. It will not be on your exam, all these things. You are from different majors. And this is going to trigger IgE response through all these processes from antigen to Th2 to B cells. And the mast cells or the basophils, I think they are something like our white blood cell, based on my limited understanding. It's going to recruit cytokines and chemokines in our system to also trigger this IgE response. Am I right so far? Or have I messed up? I don't know. Okay. IgE response is going to release something called histamine and prostaglandins. It is a protein that induces inflammation related to peanut. And whether this is going to be released, it also depends on our estrogen and testosterone. And because of that, researchers have found, even before McKenna wrote her thesis, that females are more prone to peanut allergies, right? And some other food allergies, am I right? You see, the fundamental cause is here. The only fundamental cause, gender or sex, to be precise, sex, not gender. Gender is cultural. For those sociologists, I'm sure you know. So, sex is the only fundamental cause in here. Sex determines the hormones we are going to get in our system, right? It's going to affect how the protein that induces inflammation is going to work. And all these processes ultimately affects our risk for anaphylaxis. Am I confusing so far? Maybe. All this will not be on your exam. Antigen, what's antigen? What's Th2? It will not be on your test, okay? So, in my humble opinion, peanut allergy can be explained by fundamental cause theory. Any question? The only fundamental cause is sex in this case. And for other allergies, maybe it's the same, it's only sex. But think of this. Even though the only fundamental cause is sex, the implications of peanut allergies are social. Think about a family or a woman in inner city cannot afford healthcare, cannot afford prenatal checkup or antenatal checkups. The baby will never be tested for all these allergies. What's going to happen if something wrong with the baby due to peanut exposure? Is that going to be very costly to the baby? The mother cannot afford to be tested. The father cannot pay for medical bills. The pregnancy just goes on. And all of a sudden, the kid or the young baby ate some peanuts, got rushed to ER. Is that going to be more costly than somebody who got tested and can be prevented? So the implications are social. How much does peanut allergy cost society? Do you know? Thousands, billions, hundreds? Do you know? Or we should ask Dr. Google. I asked McKenna to find this out also. You see a couple of thousand. $3,000 to $5,000, several thousand. So if the person is not aware of peanut allergy, no chance for the parent to go for prenatal care, antenatal care, or for the infant to get tested for all these risks, including Down syndromes. The social implications are severe, can you see that? And the social cost of peanut allergy, is that more severe for women or for men? Who are more prone to peanut allergy? Do you remember what I just said? Men or women? So the social cost may be more severe for women, right? And my take is that maybe the baby girl or the young girl, maybe when she took some peanuts, she got reaction. She's going to avoid peanuts in the future, she knows, through the social learning process, not to touch peanuts again. So I think it affects young girls more. And when people are in old age, their teeth are not that strong. They may be less inclined to eat peanuts. And I don't think it has a big social impact on old ladies. That's my take. I could be wrong. Because the old lady, she may remember she had some peanuts as a young girl and she was rushed to the hospital. She may never touch peanuts again. And when we look at this diagram, it works through antigen, through Th2, through B cells, through cytokines and chemokines, mast cells, basophils. But it seems very technical, right? But the social implications are quite severe as well. Imagine a family in inner city, no permanent job, no insurance. All of a sudden, the kid was rushed to ER. Who is going to pay the medical bill? Any questions?